Good afternoon, everyone. Thank you for joining us. Today, we're excited to be joined by Mr. Darren Cook. Darren and I have been talking for the past few months about this subject, in particular, point of service collections and the importance. And so we got together last fall, set up today as a good day to kind of do a training and some background information. We greatly appreciate your time today, Darren, and your expertise. We are a smaller group, so if you have questions on the line, please do not hesitate to unmute your line or put something in the chat. If you're watching this recording and you have any questions at all, please do not hesitate to reach out. And with that said, Darren, I will turn it over to you.
Awesome. Well, thank you, Laura. It's great to have everyone on. I appreciate your time. I apologize. I woke up with a little bit of a chest cold, but we're going to power through it today. And I do have a lot of information. I really enjoy being on site when I do some of these things because I just find that it's really good for me to really have an intimate understanding of where you're at. But realizing that's not feasible, I put a lot in here, and we're not going to cover everything, but I wanted you to have the information to digest a little bit and take away and maybe even share with some of your colleagues. But as Laura mentioned, if you've got something specific, let me know, put it in the chat, and we'll make sure we try to drill down in that. So, all right, here we go. If you could, next slide, just real quick background on me and, where do I come from and how do I fit into this? About 25 years in the healthcare space. I actually ran a collection agency for 10 years. My office was right next to our front counter where people came in hundreds of times a day, sometimes to make payments. And so I've been in your shoes. I've done it. I have a complete respect for the face-to-face engagement that we're going to talk about today. I remind our staff that, they spend most of their time behind the phone, which is a completely different dynamic. And we'll talk about some of those a little bit today as well. But I spend most of my days today on the magnet early out self-pay side. We also have a sister company that does bad debt, 100% healthcare. And like I said, I've been in the space for about 25 years. The things I'm sharing with you today are things that customers, friends, mentors of mine have shared with me over the years. A little bit of backdrop on how this started is I had a mentor friend who was a PFS director at a hospital north of me. And I called her, and she's a very energetic, positive person. And she was just down in the dumps. And I said, "What's going on, Mary?" And she said, "We got to let about 30 people go today. We're not making payroll. We're really, really struggling." There's some certain dynamics that were around that, but that was the bottom line. And I said, "Well, what's next?" And she said, "We've got to get this community to support this hospital. I'm done asking for permission. We're going to start some point of service collection activities." And I said, "Well, do you have any idea how much money we spend in our company on compliance and training and sending people to classes and buying books and training seminars and CDs?" I'm dating myself there. And she goes, "Well, let's meet for lunch." And so we put a plan together, and I said, "Hey, there you go." And she goes, "Oh, one more thing. I forgot to tell you, you're coming in to teach it." And we laughed, and I think I got a pan of chocolate chip cookies out of her for doing it. But kind of the word spread, and there's more people came aboard in different facilities and saying, "Hey, we want to know what you guys are doing. Here's some things that work for us. Hey, here's a train wreck that happened in our office." And that was, many, many years ago. And we just keep building on what we deem best practice. I'll tell you, some of this stuff is from for-profit facilities. You may go, "Boy, that's too aggressive for me." But don't throw the baby out with the bathwater. I want you to keep an open mind. Like a parachute works better when it's open. And stay with me if you would. But I just, again, applaud you. I have such respect for the people in the trenches and the front lines. And so I'm going to give you, hopefully, some tools today that you're going to be able to use right after this. So next slide, please. Humbling thing for us. Again, a little bit about full disclosure. Our company just shy about 2 million touch points in 2024 annually. Why do I share that? Because we have invested in tools that record every single keystroke, record every single phone call. We have the ability to query text-to-speech and speech-to-text software. My best example for you is that our staff was like during tax season said, "Hey, everybody, we got to be leveraging that discretionary income." Oh yeah, we're saying it. When we bought this software, I want to say our first scrub of every conversation we had that week, we were about a 67% success rate in actually using the word tax return. And our staff were blown away. And my point to that is that even with all those tools, there was still opportunity. There was still, that feedback loop that said, boy, it felt like we were doing, but in reality, we actually weren't. And we use those as training opportunities. And I realize you may not possess that, but we'll talk about how ways you can get over that a little bit too. Also enlightening when we created a full-time quality control officer that does nothing but monitor, mentor, and coach. And we were humbled once again on areas of opportunity. And so it's a process improvement. It's a moving goal, and you're always trying to pursue that little bit of excellence each and every day. Next slide, please. So our agenda at a glance, why porn and service collections matters. Going to give you some industry's perspective, but try not to get you too down in the dumps with some of the financial stuff going on right now. Obviously benefit to the organization, individuals, some training and practical skills. And then one big thing typically is overcoming conflict, and how do you do that gracefully with the patient, whether it be on the phone or in front of you. Next one, please. I want you to think about this. Again, if I was doing a formal training at your facility, we were spending more time and we could drill down into this. These are questions I'd be asking of you. Hey, what's preventing you from having benchmark best practice success today? Now, you might not know what the definition of that is. And have never found one. I will tell you, in Mary's case, that group, believe it or not, got their point of service collections up to 1 month. They were over 70% in ED. Now, I'll tell you, when we co-presented at a Michigan HFMA event, I think half the room thought she was lying. But she would tell you, don't give me any accolades. We waited too long to take action. And we got there out of desperation. And they bounced around a little bit on that mark, but that was about a 2-3 year period where they just said, hey, we have to do this. If someone asked me the other day, what do you think that middle ground best practice is? I think you're in that 45 to 50%-ish when I travel around the country and talk to people on where they think their spikes have been in best practice. And so by no means is anyone saying you got to bat 1,000. That's impossible. So if you had a magic wand, what are you leaving with today? I'm here to help you sharpen your skills so that we have success. And I think that's to find higher dollars in the door, improve patient satisfaction, believe it or not, more confidence at the worker level, frontline, higher job satisfaction, hopefully, because your job is extremely important. And then, what else is up there where I can maybe help you with? Next slide, please. And then if we zeroed in on that, top 3 things that hinder my success in having the conversations are, these could be different for everyone. A lot of times people just say, hey, I'm not sure what to say. Sometimes people say, I'm uncomfortable asking for money. We'll talk about that. Items I would like to specifically have help with are. So fire those in the chat. If I can address on them, if I don't touch on them with something here, I'll try to make sure I do. Next one, please. Awesome. Thank you. Here's some good ground rules. The only assumptions I make, there's nothing more important than your health. You're listening to a guy who lost 2 very close friends in his 30s. Those were life-changing events for me. Both left 3 kids under 10. Not a great summer. And so without your health, in my opinion, humble but accurate, you've got nothing. And I want rural health to succeed. I want your patients, your community, your neighbors, your friends to have the best health care that money can buy in your home area. And that is a challenge today. And we'll talk about that a little bit more. I assume we provide excellent care. I'm speaking on behalf of, I was a colleague of you. We deserve to get paid. We do not do well in healthcare with this. And I don't have time to go through a bunch of examples, but I think everyone would probably nod their head going, yeah, I don't know if that's a generally accepted assumption. And the patient has the money. That one there, you're guilty of sometimes as well, because I think we're all judgmental. Let's just face it. I live in West Michigan. I can tell you, I used to ride my bike when I first moved here in my apartment through one of the most exclusive neighborhoods that I've ever been to. I didn't grow up with a lot. And I used to remember going, boy, what does it take to live here? Fast forward, I have a friend of mine that works for the city. He said, do you know how many times a month I'm in there, Darren, shutting off the water because people can't pay their utility bills? So don't fall prey to the assumption. I grew up in a rural community. Farmers may not look like they got a lot, but I know better than that. They were the ones that had the cash. You cannot take people at face value. You've got to discipline yourself to process, make sure you ask the right questions, regardless of what's on the surface, and drive through that. And we'll talk about that a little bit more. Can't stress enough about what a team effort it is from top down. CEO, your agencies, everyone in revenue cycle, clinical staff sometimes are a problem. I've done this so many times across the country where people will say, well, we have great conversation. And they just go into the clinical room and the doctor or the nurse says, don't worry about it. Do not let that happen. Leaders on the phone, support your staff. They're not guilty of a complaint until proven innocent. It should be flipped. We're asking people to do something very difficult, and that's ask for money, which people obviously don't want to pay a lot of times. And so I can't stress enough top-down support for the staff. You're going to get complaints. In my case, and I shared with you, we're asking almost 2 million people a year to do something they want to do. Do we have complaints in our office? 100% we do. It's how you handle those. It's how you control that conversation and hopefully leave that person with some level of grace and delightful that engagement was a positive one. But do not let senior leadership either say, hey, I got a phone call from my postman's neighbor's third cousin's pet detective, and they said they got asked for money and they didn't appreciate that. Are you kidding me right now? I would tell that C-suite person, are you serious? No, your team is working hard at that front line, trying to do everything they can to fight for that discretionary income. You need to support that person, so make certain that support is there, or else you'll chop this whole program right at its knees. And I don't like to see that, but I will tell you, I have seen it done more than once, and it's very unfortunate. Okay. Next one, please. Team effort again. Front end staff, physicians, coders, we talked about it a little bit. I was sitting with a group probably 6 months ago, just observing before I taught these class for an entire health system. And a lot of the complaints were billing and coding. They had gone through a system upgrade. And it made me cringe a little bit because that frontline staff was like, yeah, they're having a ton of problems down there. Bear with us. Yeah, they're screwing up down there. I hear that every day. Don't do that. You are the healthcare system to me. You're my touch point. You're the face of the organization. Don't be throwing your coworkers under the bus. They may be terrible, but you need to push that feedback through the proper channels, not in front of the patient. I don't want to be hearing or seeing your dirty laundry. I'm already a victim of it sometimes. So please have a tuned ear for that. You're all one team. You need to be singing from the same song sheet. Nobody's perfect. But you cannot be uttering those types of comments through the organization. It is not going to leave me, the patient, with a positive experience. So be careful with that and listen for coworkers. If they're saying something like that, please nip that ASAP. Okay. Next one, please. Asking for money, that was awkward. It can be. Funny movie. I've The Office. I would test you to see if you remember that one. It's awkward for a lot of people. Statistically, about 14% of us have a hard time even talking about the conversation. Why is that important? For you that are interviewing, you need to be asking that during interview questions. If you put my wife up at the front, she's uncomfortable asking for money. She's not uncomfortable spending it, but she's uncomfortable talking about it. So I want to know that she still would be an incredible employee. She's got a huge heart. She would handle healthcare exceptionally well. She's a parapro at a middle school. So she's got a lot of skills, but that's just not one of them. So if you put her as your lead cashier, you inherently put her as a disadvantage. And so if you're not asking during interview, you don't know that about your staff, you don't know who your 14%ers are, I encourage you to figure that out. It's not that they can't be successful, but some of the things we're going to talk about today don't just come naturally. I'm the polar opposite. I got no problem. If someone owes me money, I'm like, hey, how much do you want me to assess on interest? I'll be sarcastic. I got no issue. And maybe that's why opposites attract. But know your staff. It can be more difficult for some than others. Next one, please. Why does it matter? Holy cow. I could put 10 slides up here. Again, I don't want to depress you, but bottom line, you and I as consumers are faced to spend more and more and more every year, right? And so here's some data on you. I won't go through them all, but you've got about a $3,800 to $2,000, marketplace coverage. It's big bills. I grew up a GM baby. I never knew what a copay was. Every time I went for a sports physical, my mom just gave me the card and never gave me any money. Those days are gone. I've had up to a $6,000 deductible for me and my family. That's tough stuff. Okay. So that piece of pie of that discretionary income is just getting tougher and tougher. Next slide, please, Laura. Another one, 55.7% of Americans were enrolled in high deductible plans. My entire West Michigan community, but I bet you it's 10 for 10 of all the biggest employers in my town adopted high deductible plans as soon as they're available. I think there was maybe one holdout. So back in the day when our local hospital used to be able to just push a button, Blue Cross Blue Shield paid a handsome rate, those are gone. They need to figure out a way to collect $3, $5, $6, $10,000 from every patient that comes in that's on these plans. In 2010, 141 rural hospitals have closed. I think we've had 2 or 3 here in Michigan. We want to avoid that, right? So we want to be proactive, make sure we're fighting for that discretionary income. Next one, Laura. Again, just so you have a sense of who's coming through that door, if this isn't you, but frankly, this is me. Deductibles have gone through the roof in my own household. So that orange line there is health premiums. The blue line right below it is the workers' contribution to them. And then that light blue line way down the bottom is our earnings. And you see the gap. Do you see the problem? And I'm well aware that the stat goes back to 2016. I tried finding a new one a couple months ago, and I haven't found it yet, but has it gotten any better? And the answer is no. So it's a great graphical representation of what I'm struggling with as a patient walking through that door. Now, I'll also contend, we have a spending problem, not necessarily an income problem, but we'll get into that. Next slide, please. This is what I'm chatting about. Credit card debt last quarter hit another record. Not good, right? So we've got people living outside their means. They're spending money. They're just not spending it with you. And so back to that challenging, that fight for that discretionary income, we're about and you name it, you've got to be able to get yours. And that's some of the things that we're talking about today. Next one, please. FYI, $6,800 is the average credit card debt among cardholders. So if you have none, your coworker, your neighbor has 12, 13, 6, 13, 7. It's a big burden. So file that away as some of the challenges you have, again, trying to find that discretionary income. Next one, please. A little bit of levity. This is kind of what my neighbors feel like. They know what I do for a living. So we get together often. We've got a great neighborhood and it never fails. Someone will pull me aside and say, "Hey, Darren, I got this huge bill or this or that." I'm like, I'm not to blame, but I try to help them as much as I can. Reality is healthcare costs make up about 8.5, according to the Kaiser Family Foundation, of all consumer spending. Next slide, please. You can see that's up a little bit from this pie chart. Where it was about 7%. You see, I've got it highlighted. That puts you, on par with, entertainment's about 5%. Insurance, I don't know about you, but that sure went up this last year in Michigan. All of us saw double-digit increases. Food has certainly gone up. My goodness gracious. Went to Costco the other day, and the bottom of my cart wasn't full, and it was 300 and some bucks. But everything has gone up. But I share this with you because I also want you to understand you're not the big bad wolf. I find it troubling. I've looked at more credit reports in my career than I ever want to, probably more than hopefully you ever will. When people are on the news, because it makes good news that, healthcare, yeah, this was the straw that broke the camel's back. It might be for some people, but statistically it's not. There are, Best Buy trade lines, your Verizon, your AT&T bill. It's very revealing when you look at someone's credit report, what their priorities are. It's typically not you. And, we're a circumstantial debt, which is sometimes hard. We don't budget for it. If we don't have good coverage or we're a true self-pay, it certainly can dump the apple cart. But I, as a consumer, statistically, I'm spending a lot more money somewhere else. I've got a Starbucks around the corner from me. I'm just flabbergasted every time I drive by there, that line at $7, $8 a piece. I gave my daughter a $5 gift card one day. She kept her hand out. I'm like, what do you all got? She goes, "Dad, the cheapest drink is almost $6. And I couldn't believe it because I'm not a coffee drinker. So you're not the big bad wolf. Sometimes our staff just feel heavy about, gosh, I'm asking for these bills. I understand. I get it. But again, there's nothing more important in your health. You provide excellent care. We deserve to get paid. And my assumption is that the patient has the resources to do it. And it's my job to ask for it. Okay. Next slide, please. So the staff question is, why do we need to collect a point of service? Well, we talked about it, right? I encourage you to share some of those slides with your staff so that you generate buy-in. A lot of them, this may not have been a topic of conversation 2 years ago, 5 years ago, 10 years ago. If you're part of the interviewing process, if you did not address this, they go, whoa, wait a minute. I'm a 14%er. This is uncomfortable for me. You've got to get out in front of it. You've got to keep the staff involved and engaged, and so that they're understanding how important this is. And their role is incredibly important. Can't stress it enough. Next slide, please. So speaking of that, normally if, again, I'm on site with your facility, I would ask you of these numbers so that I could share with the staff. It actually pretty often blows their hair back. But what is your bad debt write-off in 2024? What's the magnitude of the missed opportunity for point of service cash? And anyone want to hazard a guess? And I throw this out there. And of course, I didn't have everybody's. I probably could have went and looked at a few of you folks because I've got access to that. But I just threw a current customer in there. That's a critical access hospital. Next slide, please. And you can see they had clinic at 1.3, hospital about 7.1 for a total of 8.4. Their average was about $700,000 a month that was going off to bad debt. Services rendered, never compensated. That's $176,000 a week. $25,000 a day, $1,000 for the hour that we're going to spend together, 24/7 going out the door. Your friends, family, relatives, PTO members, bowling league, you name it, people in your community, probably some passerbyers or transients, which we get a lot of here in Michigan. And Mary, my friend I mentioned earlier, was in a harbor town that had a huge vacation population. So that was one of their challenges is, right, people would come in, they didn't ask them for the money, they're gone. They're back to Indiana, Illinois. They were only here for a week vacation. So they had to get their arms around that. It's a lot of money. And so what happens if we tackled that? Next slide, please. What if we did 365 days? We just assumed an average copay is $25. That probably is a little light in most markets. 250 patients, that may be high or low for you across the total system. But just for kicks and giggles, what does that add up to? Next slide, please. That's $2.3 million. I used to have a slide on there that it'd be your CFO's face if you were able to collect that much money. Now, the key is, are you going to get it all? Absolutely not. No one is expecting that. Could you get 40% of it? Could you get 50% of it? If you got $1.2 million this fiscal year, would that make a difference for your organization? Would you be able to court a new doctor for a service line that you're driving miles and miles to right now? That'd be pretty cool stuff. And so that's what I hope and expect for you. I want you to have the best quality care in your community you can possibly afford. And that's going to be financially solid in order to court those doctors. You know, I had a friend of mine's a consultant. She said doctors were finished first in their class. And there's doctors that finished last. She said, I don't know about you, but in my community, I want the ones that finish first. And I'm like, yeah, never really thought about that, but that makes a lot of sense. So next one, please, Laura. Well, how do we get there? Suzanne Wolfskill, an incredibly respected individual in healthcare. I had a chance to listen to her speak one time many years ago. She said, fundamentally, the patient access performance drives everything else in the revenue cycle. If you get this right in the patient access, then the rest of the revenue cycle flows pretty easily. Junk in, junk out, right? So that whole front end and all that's going on there and making sure foundationally we're doing the things we need to do to engage that patient, make sure we got a clean claim, so on and so forth. So let's chat about some of those. Next one, please. Process and training. Well, okay, if that's true, are patients satisfied with our process today and why? I want you to self-reflect on that. If you've not received a compliment in the last week, month, 6 months, year, there's something wrong. Okay. You're going to have to look in the mirror and say, what's preventing that from happening? Why are they upset? You got to drill down on that. You got to get your arms around it. And as a team, you got to say, okay, here's our top 3, top 2. You know, what can we do? What can we control to make this a better situation for the patient? I don't know if y'all have Chick-fil-A's around you, but we finally got one in town. Their customer service training program's off the chart. I mean, it restored hope in some of this next generation because they're so polite. Would you like ketchup? Yeah, gonna have some more? Absolutely. They do a fine job of making sure your experience is top notch. Do we possess the tools necessary for change? Meaning, you know, I've been in facilities where they say, you know, we don't have a cashier on second and third shift. And that's really where a lot of our leakage is coming from. Okay, what do we do about that? Is there a plan for that? Can we come up with a plan for that to capture that inventory? What processes can be altered today to increase point of service? Well, I had a facility that had a side door every single patient would bolt out of so that they didn't have to go back to the admin staff. Okay. Fire department frowned upon us locking that. They frowned upon bank rope blocking it off. So we had to have the nurse walk that person past that corridor, introduce them to their colleague who is the lead cashier in the revenue cycle department, and say, "Hey, John Doe, thank you for entrusting us with your care. Let me introduce you to Darren here. He'll help you with your paperwork or any other question you may have. Again, it was a pleasure serving you." Those 20 some steps of getting that person from the ED door past that side hall that went out to the back parking lot to that cashier put tens of thousands of dollars in the hospital's pocket a year. So something that simple. What training will staff require? Hopefully this is a little bit of help, but hopefully it's not the end of it. Training is continuous, right? And so think about that. And then what does success look like in the future? 3 months, 6 months, 1 year. You should have goals. If you are doing nothing today, that's okay, but today's time to start. I shared with you some guardrails, benchmark best practice around the country. I've never heard anyone do higher than 70% than Marion. Again, that was her peak, and that kind of fell back a little bit when our economy got soft in Michigan. I think that sweet spot is in that 45, 55% consistent. That's what you should be working up to. Now, if you're at 0, if you're at 15, you're at 20, is that going to come overnight? No, because you've got to change a little bit of culture internally. Then you also have to alter the culture of the community, meaning you might get some pushback. And that's okay. It takes 28 days to form a habit. You might take some heat from the community at large going, "Oh, you guys are asking for that money again." Yup. The same way the gas station does, the bowling alley does, the party store does, the grocery store, everybody else in town has probably a better margin than you. And that's got to stop. And it will stop. And those complaints will if you're consistent. If you're not, you elongate that curve of transition. And I encourage you to be consistent and disciplined to it. 28 days, 30 days, tops. I really think any kind of complaint or negative feedback drops off because they're talking about you at the coffee shop, the donut shop. They're talking about in their own home going, "Yeah, I got a call." I guess they're serious about that. And if you package it right, that's okay because they understand you're serious. And again, I want you to have top-notch health in your community, and that requires resources, as they should, right? I mean, it's not rocket science that healthcare is a little bit expensive, but you got to have it. And hopefully you don't need it. But when you do, it's in your backyard. Okay. Next one, please. Engage in the patient. Missed opportunity here. When combined, the financial and clinical engagement patient is more likely to understand treatment, understand their responsibilities, not be surprised, fight or flight takes over, right? And then meet those financial obligations. If you're not doing pre-service, if you're not doing phone calls, if you're not proactively telling me as a patient, "Hey, Mr. Cook, I see you got Blue Cross Blue Shield on the back of your card. It should say what your copay is. Can you flip that over for me or show me that card? Oh, $50. If you're not educating me and constantly educating the community at large, you're not setting yourself up for success. So engage me and proactively, if you've got people pre-screening, "Hey, Mr. Cook, you've got your surgery next Tuesday. We need you to shower. We need you to wear no jewelry, no cologne, please. We need this. We need a driver. And oh, by the way, it looks like your payment or your copay or deductible is X." Have that conversation with me so that I can be prepared to meet your expectation. Huge opportunity. Not enough of that's being done. Next one, please. First and last impressions. Hey, wait a minute, that's us. We're often the first and last touch point of a patient. That means we significantly shape the patient's view of our facility. If you do a great job, I might go tell 4. Unfortunately, if you do a bad job, I'm going to go bark at the moon and I'm going to tell 10. My best example here is we all have had dinners and restaurants where the food might have been so-so. Maybe it was garbage, but our server was hilarious, or our server did everything possible to make our experience a good one. You're it. You're it. I mean, providers are not perfect, right? They come in, I'm tired, I'm missing a day of work, I'm not feeling well, and they get your first impression. They go, "Wow, that was delightful." I get in the room, doctor, provider, LPN, whoever is off a little bit. Life comes at them as well. Bedside service wasn't that great. Well, it wasn't that great, but I come out and I get you again. Mr. Cook, I can't thank you enough for choosing us for your healthcare needs. Here's what I need. Boom, boom, boom. I left you with a last impression that was positive. That's your takeaway to the car as you walk out. That's your takeaway when you get back to the office and explain why you were an hour or two late. Hey, I had to go have this or that. But boy, what a delightful experience. The woman, the guy there, whatever, was perfect, was awesome. That's us. Don't forget that. And we'll talk about how important that can be accomplished and what some things we can do here in a little bit. Next one, please. Why invest in the time to pre-register? I've hit on that a little bit, but the reality is it's the only cost-effective way to collect those small balance copays and deductibles. I cannot tell you how many clients I have and how many people I know that are friends and mentors and not customers that are running either a high volume clinical, average balance, $100-200, national average, your margin is less than 4%. So on a $100 account, at the end of everything, you got $4 to put in the till, but they're sending out 5 and 6 statements. And oh, by the way, if their average is 100, they probably have 30-40% that are under 50, under $25. Well, if your margin is only 4%, 10% is $2.50, 5% is $1.25. You got about $1.15, and you sent 4 statements. You're upside down on those small balances. They will kill you. You've got to collect those up front. You do not want to be sending statements or paying a vendor to do that. You can't win. There's not enough fuel in the engine to attack those balances, which are high volume, but low dollar. It's not the pond you want to play in that's going to fund a successful organization. So make sure you're out on looking at those and on top of that. Next one, Laura, please. I don't discount there's a lot going on. This is one of my favorite slides. I've sat with your front end staff all over the country. I have such respect for staff that excel in this area for how much is going on and managing people who, again, are tired, who are ornery. But you've got to do it. You've got to find balance. And we're going to talk about some ways to build margin into your day, knowing all this stuff is going on. You've got to be strategic. I think most people are guilty of working volume. And I would say, and I've got a couple slides and hopefully give you a couple tips on where you get a pass to let people go. You can still posture, you can still discipline yourself to procedure, but you're not going to die on a battlefield of a $20 account. Again, it doesn't do much to go toward your salary, the new roof on the hospital, or any other expenditure. And so we'll talk about how to be a little bit strategic and develop margin in when you're swamped, or maybe your colleague called in sick and you just got this lava flow coming at you. I'm not going to beat myself up over that. I'm going to do the best I can, but I'm going to build in margin by being a little more strategic. I'm going to share a couple things with you when we get there. Next one, please. Quality input. Again, I listened with a tuned ear when I'm what I call rounding and listening to staff. Any change in your address since your last visit? If I had $1 for every time I heard that, boy, I could be paying for my 4th daughter's wedding in May. Yes, $4. 2 got married in 19, 1 got married in June, and my number 4 gave me 11 months to recoup. So, it's all good. At the end of this, my GoFundMe page is going to pop up. I'm teasing, it will not. The correct way you should be asking this to ensure your information is correct so we can accurately bill your insurance. We need a few pieces of information with a smile on your face. You grab that card. My physician group I go to scans that thing. I don't care if I was there yesterday with my daughter. I walk in, they're scanning that thing. It's a constant moving target. Make sure you're capturing proper good information. What's the best phone number to reach you at? Again, I'm tired. I'm not feeling well. I'm missing work. I'm stressed. All I want to do is get past you into the provider and have them help me and make me feel better. And so make sure you're watching my body language. Make sure you're getting the right information. I'm just not mumbling through this. And if you ask the wrong questions, you set me up to just blah, blah, blah. Yep, no. You ask a closed-ended question, you got a closed-end answer. And that's typically not a good one. So be careful here. Look at some of the scripting and make sure you've attuned to your teaching staff to appropriately ask the right things. Okay. All right. What else? Insurance. May I see your card? You're currently working. Yep. What's any change in your address? Insurance change since your last visit. Self-employed is a big one. Make sure you get that business card. Don't assume they're unemployed. Where are you currently working? See the difference? Make sure you're digging for information. I spend thousands of dollars a month trying to skip trace your patients on behalf of our customers. They're walking in right under your nose every day. Yet I'm spending an ungodly amount of money trying to find a phone number and a correct address for a lot of your patients, as your strategic partners are. So a lot of skill set can be deployed here to really help you out. Next one, please. Is the customer always right? Show of hands, yes or no. If I was in front of you, I dare say there's a third option. Click, please. And my friend Medina would say, oh, hell no. We used to teach this, in the 80s, I think. I'm dating myself. The customer is always right. They're not. They're not. I'm in healthcare, and I can tell you I'm struggling with a healthcare bill right now. I'm in between my provider and my insurance company, and even I'm confused. And I've been doing this a long, long time. So you've got people coming in that are adamant. Maybe their neighbor told them or their spouse told them, hey, this is the way it's supposed to be. They don't understand. And so sometimes, again, with that confidence level, with the right training, you got to steer me. You got to neutralize and conquer me and say, Mr. Cook, that is actually not accurate. You've got to have the right skill set. And that's very difficult face to face because, again, if I'm kind of escalated, you've got to figure out a way to neutralize me and then come at me with proper speech and that confidence so that I can back down a little bit and go, oh, okay, maybe I don't know it all. She or he is actually trying to help me. Let me listen a little bit. Let my emotions subside a little bit so that we get to a resolution. But we all know patients are seldom, if ever, never always right. So how do we do that? Next one, please. Confidence. I mentioned it. Your word choice, your tone, and your body language. Here's where we're going to get into some meat. And again, if I was with you, we'd have some fun with this because there's some examples I normally do. We can't be a webinar, but I want you to think about yourself. I want you to think about your coworker and don't be putting their name in the chat. I'm kidding, sarcastically going, oh yeah, I know who that is, but let's have a little bit of fun with some of these. Okay, next one, please. You could print this, which is a great idea. I never actually, two individuals I taught this class for, when I followed up, I was there months later and I ran into them in the cafeteria. And I said, hey, how's it going? I said, hey, we had a lot of fun with your training. Appreciate it. I said, what'd you do? And they said, hey, remember the word choice? We printed it. And we work side by side almost every day, 8 hours a day. And so we created a game. And if we stroke count, if I hear my colleagues say, nope, it goes in the red column over here. If they do it well, I click it over in the right and whatever. By lunchtime, whoever's winning has to buy each other a soda. Whoever at the end of the day does this or that. And they had a lot of fun with it. I encourage you to do the same. These are blind spots for us. You typically will not hear yourself say these words. For instance, I don't profess to be a public speaker. I'm an ops guy at heart. I love operations. I just did it. I have no idea how many times I've said that. Probably not a good thing if I was a professional speaker, but without someone giving me that feedback and helping me do better, I would never hear that. And so I have to be able to take constructive feedback, number one. I embrace it at this point in my life. I wouldn't do that so well when I was younger, to be completely transparent. But I want to get better. And I trust my colleagues do as well. And so I owe it to them to say, hey, let me give you a couple tips. Or, hey, just FYI. Or, hey, holy cow, what happened to you this morning? You're off your A game. Go get a drink. Go take a break quick, but this next patient deserves your best. But this is some great words that I want you to listen to, either coming out of your mouth or a colleague. And I really, really want you to spend the most time over on the right. Next one, please. How might these differ in person, phone, through email? In person, right? My nonverbal, which we'll talk about, by phone. You've got to smile when you talk. I can hear it. I promise you I can hear it. Through email, the classic example is if I 100% caps you, right? I'm yelling at you via email. I made that mistake one time and I was not trying to do that, but didn't even realize it when I was in a hurry. So that we had some fun with that. But be thinking about the different communication channels and how you can apply those. Next one, please. Huge here. Nonverbal. Face-to-face, customers can sense it. If your tone is lacking empathy or compassion, you've lost the engagement. Cannot stress that enough. Smile when you speak. Look at the pie chart for me. 55% is your body motions and arms, your nonverbal. 7% words, 38% tone. So for those of you that are communicating over the phone, you've got the 7 and the 38 is your 100%. So if one of those are off or they're both marginal, you're in trouble. If you're multitasking and the phone's going all over and I'm cutting in and out, I know that. I can hear that. If you came to work and, life came at you and you got more baggage than a Ryder truck and your tone and voice is you're trying to do the best to fake it, but your nonverbal is I am ticked at the world. I read you like a book. It's no good. You know, and again, it's a blind spot for some. And this is where, again, as coworkers and colleagues and, holding each other accountable, the patient deserves your best. And sometimes that life is going to happen. We need to brush it off, take a deep breath, hang up the phone and go, wow, that wasn't real pleasant. Hit your knees. Thank God you don't have that personality. That next patient through the door deserves your best. Next one, please. How many are guilty? I mean, a little bit of levity. Can you hear me now? With proper tone and voice inflection, but the fact that I'm looking at the cat there, that's not real positive. I actually had a client print this that had their own call center, and this was a rotating picture. So if someone didn't handle a call real well and I heard it, I could hand this to them. And the same thing, they had a little bit of fun with it to keep each other in check. If it ended up on your desk at the end of the day, you had to put 50 cents into a jar or something, and that went toward donuts and pizza. But it was just a way of keeping a tough environment light, holding each other accountable and keeping each other accountable to the raised bar they were trying to achieve. Getting to work and find out your short staff, how many are guilty, right? It happens. You come around the door and there's your first patient. You got to go, oh, shoot, my nonverbal wasn't on point. It happens. But just be mindful of it. Next one, please, Laura. We do it on time. I'm going to speed up a little bit. Attitude. I want to make sure we have time for questions. Goes without saying, right? Interest, action. I highlighted this one because over 90% of customers consider taking ownership as the primary factor in the wow customer experience. I would tell you I travel a fair amount. Sometimes it goes in spurts. It's not that glamorous. If people say that, they've never done it. I'm watching all these people in the car rental line leave upset. I have a 3-hour drive. And I've been traveling for, I think, 10 or 12 hours already. And I'm thinking, oh my gosh, what is going on? Are they out of cars? Is their system down? Ugh, my anxiety is DEFCON 5 because it's already going to be midnight, 1 o'clock in the morning by the time I get to my hotel. I get up to the counter. This wonderful young lady says, do you have reservations? Absolutely, I do. And I'm like, please tell me I'm not going to be one of those people that just left frustrated. She says, Mr. Cook, I got you. Could not give you a better example of how her ownership and the confidence she exuded put my stress at ease, going, oh, I got a car, I'm out of here. Take ownership. Don't go, oh yeah, the people out in the lot, they're so far behind. They're just terrible. There are a bunch of sloths out there, and so we don't have cars ready yet. No. Oh, those people in billing and coding, yeah, we get that complaint all the time. No, you are the facility. Mr. Cook, I got you. I'm sorry to hear that you had that issue. They're working really hard down there, but I'll make sure that feedback gets to them. I got you. Let's see how we can handle this. Take ownership. Tone and voice inflection at the bottom. Single most neglected, yet one of the most powerful. You've got to have the empathy, though. If there's any kind of sarcasm, any kind of, I just lost the word I was looking for. You've lost it. Condescending, gone. You've got to have empathy, right? And so make certain that exists, especially with your coworker, because it's going to be a possible blind spot. Next one, please. Core steps. All right, let's get into some practical examples of what to do when I'm either on the phone or face-to-face. Identify the patient by name. Identify yourself. Thank them for choosing your facility. Some of you go, wow, we're not doing, you should be. I was at a remote critical access hospital the other day, and they're like, wow, our next facility is like 55 miles away. And I said, oh, really? I said, may I point you to a parking lot about 3 blocks away that was visible from my hotel room? Are you familiar with the med center that opened? They're like, no. I said, do you realize you have a national competitor right in your backyard? And oh, by the way, the parking lot was full. You've got competition. Telehealth, ever hear of that? You've got competition. You should be thanking them for choosing your facility. Again, if nothing else, you're building rapport. So, take stock in that. If you're not doing it, that's a missed opportunity. Take care of those registration details. Again, very important. Present that patient their financial responsibility if you know it. Ask them for that payment in full. Psychological pause. Silence is power. Don't be the first to speak. Let's see how this plays out. Next slide, Laura. Let's watch this. What this should look like. Hi, Mr. Smith. My name's Darren. Thank you for entrusting us with your care today. Your balance due is $150. For your convenience, we accept cash, check, or credit card. Which will you be using today? With a smile on my face. What happened there? I acknowledged them by name. Everyone wants to hear their name. Introduce yourself, building rapport. Thank them for choosing your facility, building rapport, and gracious that you're here. State your expectation. And the key is I gave them choices, all of which support my objective. If I would have just said your balance due is 150 and stopped, it's very possible they escalate emotionally. But when I finish the sentence and I say, for your convenience, noticed I postured him. I planted that seed in my brain. Oh, convenience. For your convenience, we accept cash, check, or credit. Multiple choice answer. I didn't see the MasterCard or Visa logo on the wall. I don't have my debit card. I don't have my HSA card. Good to know that I can pay any of the above. I went from a potential emotional situation to having my other side of the brain have to answer a multiple choice question. And I can't balance emotion and process that at the same time. So hopefully you navigate right through that. So I encourage you to finish the sentence with a smile on your face and then pause. Let me process. I was with some folks a while back. The person paused. It's actually kind of uncomfortable. I was standing in front of you. We'd play a little game and we would do it. Some of you would start moving in your seats in like 10 seconds or less. You're not comfortable with it. I'm not either. Some of you are like, I don't care. I'll sit here all day. It doesn't bother me a bit. Most people don't like it. But in this particular case, silence for you in negotiations is power. Let me process it. Now, there comes a point where if you see I'm really uncomfortable, next slide, please. Let's figure out what the solution is. Mr. Cook, I see you paused a little bit there. How can I help you? I don't have any of those on me right now, but I really want to pay my bill, blah, blah, blah. Whatever that situation is now, find a solution, close the deal, and evaluate yourself. What did I learn? What can I share with others? What didn't go so well that I can avoid in the future? We do this all the time in our office. We will take good and bad in our training seminars, and we're open books. And we laugh with each other going, even our 10-year employees or 20-year employees that sometimes fail because they do. They're gracious enough to say, hey, here's a phone call. We can play it as an example. This person really escalated. I wasn't able to neutralize them. I lost the call. Not proud of it, but it's great for new employees to see that. So they're human as well. Two people talking, one's in control. It needs to be you. Right. And so typically the person asking the questions is the one in control. But be that advocate for me. It's a difficult process. Again, I'm not feeling great. It's stressful. Have the empathy, have the skill set, help me, and you'll build that rapport. Next one, please. All right, I can speed up. Feel, felt, found, neutralize. I would love to pay, but pink flamingos flew over I-80 this morning, and that was it. I just said no. Mr. Cook, I understand exactly how you feel. It's interesting. Someone else said that the other day. But let me tell you what I found. The pink flamingos have no bearing on whether or not your bill is due. I'm here to help you. I got you. This da-da-da-da-da-da. Now, obviously, I'm being sarcastic, but you've got to have a transition, right? You've got to keep me from escalating. You've got to acknowledge it shows you're listening. You need the empathy. If it's not there, you've lost it. But then convert me to a sales position or again, solution that meets your expectation. Next one, please. Oh. Here's how we're going to build in margin. There's a lot going on here, but there's a pie chart here. I took a few of my customers and dumped them in here. What I want to show you is range 1, 2, 3, 4, 5, 6, 7, 8 are dollar amounts. And I break it out by percent of total based on volume, percent of total based on cash. So when you're swamped at the front end, I want you to know statistically, range 1, 2, and 3, $0 to $150 in this particular case are about 76% of these hospitals' total volume, but it only represents 14.8% of their total cash. Why is that important? We don't get paid on activity. We get paid on results. So as a manager, as a person at the front line, I don't get paid on activity. I get paid on results. I want my team to focus on results. If there's 15 people in line, it's stacking up. I'm the only one there. And a range 1, 2, and 3 person comes in. I would posture them and say, your co-deductible is paid. You can take cash card or credit. I don't have that for me today. No problem, Mr. Cook. Just so you're aware, it's due at time of service. And so the next time you come in, if you could bring that, that'd be great. Have a seat and we'll call you up. Another person comes up, they're in range 3, same. Next person, same. Next person in range 1, same. I'm getting through those as fast as I can because I'm only putting 14.8% of our cash at risk of that 2.2 million I showed you earlier. But when a number 6 comes up, and they are 1,000 to 5,000. They're 28% of our cash. I get paid on results, not activity. Mr. Cook, I appreciate you sharing that. Now I'm going to peel the onion and I'm going to have a more granular conversation because I built time back, margin in my day. Now there's only 4 people behind them. I'm on schedule and I can actually have 1 or 2 more qualifying questions for Mr. Cook because that 1 to 5 grand, I need to get that. That's going to make a mark. And so when you're busy, I want you to think of this pie chart and go, okay, range 1, 2, and 3, I'm going to posture. I'm going to discipline myself to procedure. And I'm going to ask, but I'm not going to get all upset if they don't have it. I can't stand here too long. I got to get to those range 6, 7, and 8ers. And I got to build margin in my day in order to have a better conversation with them where the real money is at versus some of these low dollar accounts. Hope that makes sense. Next slide, please. All right, some more scripting I put in here for you. I don't have time to read them all, but I wanted you to have some of these. If you could go to the next one, Laura, please. You can read through some of these. I can't afford to pay right now. Never fails. That's okay. Thank you for sharing that with me. We have charity care. We have payment plans. We have a loan process. We have this. Could you do $20 a month on a $1,000, $500 bill? A lot of times staff will skip to the lowest common denominator of your guardrails of your payment plan. No. Do not do that. We have a saying in our office, what you do with your money, we hope you give some away and God bless you for it. We don't have that right with our clients' money. And I assure you, we hear a lot of tough stories out of those 2 million touch points. We would love nothing more to say, gosh, if there was ever a family that deserved to have this written off, it's this one. But I can't do that. I've got to discipline myself through this script, as tough as it is, because that's the job that we were hired to do. Those are tough days. But the response should be, Mr. Cook, I appreciate you sharing that. How short are you? I don't care if it's a $50 bill or a $5,000 bill. I was given an audio the other day of a substantial bill. And the gentleman said, well, can I do $3,000 right now? And can I pay you the balance in 2 weeks when I get paid again? I don't know what that fella did, but I don't have that discretionary income. Did I mention the 4 daughters and the 4th wedding? You know that. But the response is, I appreciate you sharing that. How short are you? Let me tell you, well, I don't have any. Okay, no problem. I know where to go with this. I might need to go charity application. I may need to go here. I need to assess. A lot of times people are going to say, can I do 100 a day or can I do 50? That's way better than your 20. It's way better than your minimum payment plan. You're not the bank interest-free loan of your community. Do not be doing that. Okay. Next one, please. Validation. Again, just some more things for you. Kind of along the lines of feel, felt, found. Again, have some empathy, understand how to neutralize me, just some more scripting that may fit better for your style. And again, I'm going to give you this so that you have it, and that this may be more comfortable saying this as you navigate some of those challenges. Next, please. Action items. Again, some more scripting. What can I do? What I can do is this. Can't, never, could do anything, couldy. I forget who said that to me one time, but I thought, oh, that's probably not the proper English, but it's truth, right? I don't want to hear that. I'm frustrated. I want to hear what you can do. I want you to be that lady in my line at the rental place that said, Mr. Cook, I got you. So however you will comfortably can say that with success, use those power phrases. Okay. Next one. Putting it all together, I can see, understand again what I can do for you. Marriott doing whatever it takes to ensure your guests return, right? I have 4 health systems in my community. I can go left, right, east, west. If one upsets me, great, I got 3 other. You want people excited and delighted to come back to quality of care to your facility, and you want that excellent mark. Next one, please. Evaluating yourself. Did I achieve my objective? Maybe not. You're not going to bat 1,000. For heaven's sakes, if you're a Major League Baseball player, you get into the Hall of Fame 3 out of 10 over your career. So don't take yourself too serious. We're all human. And if you've ever dealt or if you've ever waitered like I did or waitressed, people are tough. I used to joke, everyone should be the return lady at Kohl's after Christmas. You'll get trained on how to deal with people. Did the patient leave better, feeling better about the experience? Again, because it is the experience. It's just not the bedside care. Sometimes, and statistically it proves it, you have a bigger impact on my experience than the clinician did. Don't ever forget that. What could I have done differently? Again, if you got to fall on the sword, go, boy, that wasn't, I didn't do well there. And, I need to do better next time. The next time that person comes in, I'll know how to handle that. And what can you share with the team? Wisdom is learning from other experience. That's a big one. Next one, please. We've got some training booklets. Next one, please. That actually a customer of ours helped put together. I've got some of these as resources. You can get a hold of me and I'll ship some to you if you like. Just cheat sheets that I think are great reminders that have some of the different stalls and objections that you'll hear from patients on why they haven't been able to pay their bill. There's some scripting in there, and add your own. But I'm happy to send some of these out to you. Typically, again, when I come on site and we're training staff direct face to face, I bring a whole bunch of these and everyone gets one as part of the team. And I'm happy to extend those to you. So just let me know if this might be a resource for you. Next one, please, Lauren. Let me leave you with this. We're coming up on time and I wanted to have at least a second for questions. Relax, right? It's a process improvement, not a life or death situation. One of my mentors used to say all the time when meetings got kind of hot, hey, relax. No one dies in our department. It's revenue cycle. We're all very passionate, but let's, keep our focus. Communication, remember to control that tone, voice inflection, smile. Critical for your nonverbal when you're on the phone, not to mention face to face, but especially on the phone, I can hear it. Make sure you're sitting up straight and you're projecting. Set realistic goals and expectations. Again, that 35 to 45% is what you want to work up to. You get over that, you're getting some high fives. Develop that plan, work your plan, have a little bit of fun along the way by meaning celebrate your successes, right? It's a tough thing to do, asking people to pay for something they don't want. And it's a circumstantial debt. But I can't say enough how much respect I have for the people in the front line and the trenches that are dealing with it all day long and having success with it. It's a tremendous skill set. And then again, celebrate that success. And then I think questions. Laura, I'm right up against the line, but if there's anything in the chat or anything I can answer real quick, would love to.
It was a lot of really great information. Okay. How can we get a copy of the scripting manual?
Yeah, if you just want to shoot me an email with your contact information and the address and how many you would like, I could happily pick away at shipping those out to you, and happy to do it. And they're just great resources for new and old, right? We always just sometimes need to get back to the foundation, and they're just a helpful tool. Happy to do it. Email and your information and number you want. It'd be great.
And Robin and Linda both said it was a great presentation. And I agree. So any questions real quick before we hop off the line? Well, if you're watching this recording and have any questions, or if you get back to your desk or meet with your team members and have any questions, please don't hesitate to reach out. I can help put you in touch with Darren. Thank you guys all for your time today. And yes, Darren, we will be able to share the slides.
Absolutely. There is nothing on here that's proprietary. These are all things, like I said, that customers and mentors of mine in the industry have been gracious to share. So if you can use it, you're welcome to it. You can cut, chop. I have more stuff too. It's tough getting it all in a hour or less presentation. So if I can help in any way, or there's something specific that comes up and you say, hey, do you have any more material on this particular topic? Or is there a way, maybe, we need some more information on customer service? I have a lot of content. And if I don't have it, I'll keep an eye or an ear to the ground. And in my travels, if a colleague has it and I can get my hands on it, I'll happily share.
Well, thank you. And yes, we recorded this session. Once we get it uploaded, we will we will email you a copy of the link as well as the slides. So you'll have them for your reference, but also please share it with your team as well. So thank you. And thank you, Darren, for meeting with us today. We hope you get to feeling better.
Oh, I will. I shall. And thank you. Always an honor. Appreciate all your help, Laura. And I hope it helps.
Yes, thank you so much. Everyone have a great rest of your day.